I guess I should start back when I was pregnant with my youngest child. I have difficult pregnancies, and that one was especially difficult because I was on bed rest for 5 months. And then a week postpartum, I started having a lot of chest pains and difficulty breathing. I ended up in the cardiac unit of the ER. And after a process, we figured out a cardiologist, one of the best cardiologists in Utah County, sat me down and he said, okay, we're looking at, you have pericarditis, you have fluid around your heart, the valves in your heart are not working right, you have mitral prolapse, and the chambers are stretched out. So I had this adorable newborn baby, and I'm just like, okay, but look, I have this beautiful baby. I was just so in love with this baby that he knew I was a little blowing him off, because also in my mind, I'm like, I am an athlete. Like, I cannot be a sick person. So finally he looked at me and he said, you have the heart of an 80-year-old woman. And that just took me back, because it was like the first time, I think, in my life that I felt like, wow, I am mortal, you know. So and back then we didn't know I had Lyme disease. So kind of on its own, my heart improved with exercise and a healthy lifestyle, and this great doctor to help with the chest pains, because I had so much pain. He put me on a steroid, which is probably the worst thing you can do for Lyme disease, because essentially you're suppressing the immune system, and so the bacteria can just thrive without any police. So I had like a period of time where I did quite well. I had a season where I competed in 10 different races. In the triathlete, I loved like exercising as a high school swim coach. My degree's in health promotion and education. Like, I'm really passionate about health. And then after my last race, doing Lotaja, I felt I just wasn't recovering. And my energy was not there. And in my mind, I tried to rationalize it, saying, you know, this is just because I'm not giving myself enough time to recover. Oh, and I was doing CrossFit on top of that. So I was stressing my system a lot, and that's when I went downhill fast. So I went to a local MD, and I'm so grateful for him, because he was willing to look at the alternatives, and he was open-minded and willing to work with me and explore things. I also ended up with mold disease shortly after that, which again really affects the immune system. And I went up to a clinic in Idaho. We spent a lot of money on nutritional IVs. I would say that stabilized me, and I felt like I was supposed to go up there, but it didn't get me into remission. It wasn't the answer. I did something called the Marshall Protocol for 3 years, where you have to avoid vitamin D. I couldn't go out in the sun. It was a major lifestyle change, and it was a difficult lifestyle. I was towards the end of those 3 years, my body could no longer regulate really basic things like sodium and electrolytes. So with a complicated mixture of stuff going on, including a serious urinary tract infection, I ended up in the ER, and my organs were shutting down. And the ER doctor thought I was drug seeking. So again, going back to, you're so afraid to mention chronic Lyme because automatically you're going to be dismissed. And so here I was, like, just desperate for help. I wasn't even wanting pain medication, but I was dying. And another doctor came in and said, the reason why you're confused, and I was having all these seizures and the worst pain in my life. And he came in and said, the reason why you're confused is because your sodium level's at 20. Now, usually when people hit letting that low of a sodium level, it means a coma. And I did end up going into a coma. And I think it was only divine intervention that I survived. Because that night, it was a long night, but my sodium's dropped down to 14. And at 13, they start looking at organ transplant, a donation. So we kind of came through that, and I stopped the Marshall Protocol, and I had 6 months where I felt like I'd bounced back, and I was feeling so much better and excited to be doing the things I loved again. And then I started going downhill again really fast. And again, I felt like I was dying. I was having 3 seizures a day, and up to 5 a day. And MS symptoms. Lyme can look like it's the great imitator, so it looks like a lot of other illnesses. So I had all the symptoms of MS, and I was neutropenic, so I had no immune system. And again, my organs were starting to dysfunction. My heart murmur was back. And so in a leap of faith, we flew out to a center in Kansas and got treatment, 3 weeks of treatment, which I feel like saved my life. And, there's always a lot of guilt that we invest so much into my health. But when it came back to it, I thought, I'm fighting because my children need a mother. And even though this battle is not well recognized, my children need a mother. So it's an ongoing battle to maintain my health to a point that I can care for my children. And I'm so lucky that I have the amazing, amazing, kind husband that helps so much with the care of our children. So I look healthy. Like if you looked at me, you'd be like, she looks so healthy. But every day I never know what I'm going to wake up to. This morning, for example, I woke up to kidney pain and tremors. So that's kind of what the tremors look like. So if I hold my hands down, you can't see it. But and I recently decided after going out to Kansas that I needed to be able to stabilize myself with that treatment. So I jumped into antibiotics, which was kind of like my last resort because antibiotics are hard on the body. So antibiotics helped a lot. They did work. And I also started using a Rife machine, which if you look up information about Rife machines on the internet, it's not good. But I found a company that has over 1,500 researchers and doctors that support their product. And a Rife machine, to put really simple, it's like an opera singer hits a certain note and cracks glass. But essentially you're vibrating these bacteria to death or whatever cell you're targeting. So that pushed me into remission, but I was still really struggling with the viruses. So even while the Lyme was in remission, I still really struggled. And then I got a really bad kidney infection just this last July, which threw me back out of remission. So here we go again. So I started reading. There's an amazing Lyme doctor, Dr. Horowitz. He's kind of recognized well nationally, and he's done research on leprosy medication for treatment of Lyme. Because Lyme is a persister bacteria like tuberculosis or leprosy. It's so ironic that I talk about how this disease is like you're treated like a medical leper. And then I ended up just recently trying this leprosy drug. The research was really hopeful, but my body didn't do well on it. My liver was damaged and really anemic, and I had migraines every day, so it wasn't sustainable. I couldn't do it. So I'm back on the antibiotic train and still Rifing, which I think is an incredible tool. And then just always praying that there's going to be a cure someday. So that's kind of where I'm at. Really, really late stage Lyme looks a lot like Alzheimer's. Because generally people who pass away from Lyme disease, it is because of the heart, the brain, or the immune system, so Alzheimer's, late stage, it's like where the bacteria is in the brain. And we're seeing like a lot of famous people in the public now coming out about their chronic Lyme disease and being misdiagnosed, because it can look like a lot of other illnesses. Most people experience joint pain, that's kind of common, and headaches and mitigating pain, so pain that just moves throughout the body. So it's kind of like living with the flu every day. So people who initially get a bite, sometimes you get the bullseye rations, sometimes you don't. It's kind of nice if you get the bullseye because that's kind of a telltale sign. But one of the other problems that the difference between ILADS and IDSA is that about the testing. So IDSA is saying the testing is accurate, where ILADS is saying our testing is not accurate, and we've got to find better testing. In fact, is it Maine or Massachusetts just passed a law that if you go in the ER, you get a test for Lyme and it says negative, you have to sign a consent saying this negative may not really be a negative. It's like the chances of getting a positive are worse than flipping a coin. It's super inaccurate. So there are kind of like two standard tests the CDC uses. It's the ELISA and the Western blot, and it's a two-tiered process. So the ELISA is probably one of the worst tests possible. But if you have like an acute right away and you have the right kind of strain that they're looking for, then you can test. I mean, most of us don't have positive ELISA tests because it's just ridiculous how inaccurate it is. The Western blot looks for different antibodies, and that's probably a more better test. There's a company out in California called IGeneX, and they have the most sensitive Western blot. But even after you get the test, you need to have a doctor that's called a Lyme literate doctor look at that test and interpret it. Because the CDC may not recognize it as a positive test, but it doesn't mean it's not positive. For example, I had 3 positive bands, so I definitely had antibodies in my blood for it, but the CDC still wouldn't recognize that as a positive because I believe they say 5 bands is a positive test. But so you have to kind of do symptomatic and blood work tests, and I talked about the CB57. There is Dr. Horowitz, I kind of mentioned his name before, who's very involved in ILADS. He has an online test, like a checklist you go through and check symptoms. Kind of a classic telltale sign of Lyme is that it's migrating pain. So it kind of every day it's different and moves around. That's kind of a sign. But that's a good test to look at, along with, of course, like scientific testing. Some more naturopathic doctors will use energetic or frequency testing, like a biomeridian machine, or there's a lot of different names for that type of testing. Personally, I think those tests can kind of give you a direction to go, but for me, I really, again, that type A driven personality, I had to know for sure. So I had, the Western blot with 3 bands. I had a doctor look at my blood under a live microscope, and naturopaths will do that and diagnose based on that. Some of them, not all of them. And that's not FDA regulated. So I did that test. And then I did like biomeridian, which is like, it's like almost like a lie detector to the central nervous system. And that came back positive. And then, but again, I wanted to know for sure. So we invested in a test put out by Advanced Labs, and this was developed by Dr. Horowitz again, I believe. And it's a blood culture. So they take your blood and culture it for a couple months. And if they see spirochetes in your blood at the end of a month or 2, then it's a definitive yes. And I think even after some of us get diagnosed, we go through a denial process, just like any grieving process. You don't want to face this illness, or so you kind of go in this, and I still do it, like get into denial. Oh, I'm fine, and then I'm like, no, this is real. I really have this illness. It's like a $700 test. It's a really expensive test. And it's not considered, like, the only reason why the FDA didn't approve it is because it's expensive. You have to catch one spirochete in the blood. So if it's like in a dormant stage where it's hiding out in your tissues, then you're not going to catch it in the blood. So some doctors will put you on treatment for 2 months to try to kind of aggravate the Lyme and bring it out before they'll do the testing, like the Western blot or the blood cultures. So it really just depends on the doctor. So if you're like, wow, I have someone that has a lot of those symptoms, where do I go next? How do I look? And what I suggest is that you go to the ILADS website and look up a Lyme literate doctor, or look for local support groups that you can ask around about different doctors and who are educated. And we even have some doctors that are Lyme friendly. They're at least open-minded to look into it. Bacteria are different shapes and forms, and Borrelia is like a little spring. It's in the shape of a spring, and they call that a spirochete. So also syphilis is a spirochete. There's different tests for all things. Like arthritis they look for inflammation markers. MS, they do brain scans or an MRI. In fact, I had an MRI, and a lot of people will get lesions in their brain or white spots that look like MS. So a lot of people get misdiagnosed. Each Alzheimer's has it's probably more of a symptoms, and then because from what I understand with my grandfather is they couldn't officially diagnose, and maybe this has changed, but they couldn't officially diagnose as Alzheimer's until they actually do an autopsy. And I think it's just fascinating though that there's been some research done that on Alzheimer's brains that they found 9 out of 9 brains have spirochetes in them, or Lyme bacteria. There's, and if you have MS, it doesn't mean you have Lyme disease. People can have MS without having Lyme disease. So it's tricky because it's such an imitator. And I think it is. There's such a variation. So I have a good friend that went on antibiotics, and she does well. Every once in a while she'll have a flare-up and have to take antibiotics, but overall she is in remission. Like, things are not active, and even if it doesn't take much to get her back to where she needs to be. Generally the prognosis is not as good when people have been misdiagnosed for 10-15 years, or you have the genetic issues that add to it. Generally, people that also have heavy metal poisoning or mold problems or the genetic problems have a harder time overcoming the illness. And it also depends on how many co-infections you get along with it. So it really varies person to person. So some people do great, and other people, it's just a really slow decline. It's usually people who relapse multiple times or can't do antibiotics. It's a poorer diagnostic, because then you have to look at other options, and and like I said, you could use the same treatment on the same people and they respond so differently. Like this technology I use, the Rife machine. Some people just don't respond to it energetically, or they have EMS sensitivities that make it that they just don't do well with it. For me, I respond really well for it. I remember the first time I ran, they uses a plasma bulb. The first time I used it, I could just feel it in my brain, these bacteria. And for 3 days, all I could do was watch Netflix because my brain had just been so affected by using this treatment that I couldn't focus. I couldn't handle any stress. All I could do for 3 days was watch Netflix. So some of these people are bedridden, paralyzed, can't function, and other people are out exercising, and they have to be careful to keep their immune systems up but do well. I don't know, to be perfectly honest, and that's hard for me to say. I wish I could tell you, in 2002 I was bit by a tick, got a bullseye rash, but I honestly don't know. My paternal grandfather had Alzheimer's disease, and my grandmother had a lot of autoimmune disease things, and sometimes, like I said, there's research that shows it can be passed down congenitally. So sometimes I wonder if I was born with it. I wish I had a set answer. I mean, it's all speculation, really. In high school, I remember I had a lot of costochondritis in my chest, a lot of inflammation and pain. Like during swim team, I had to take anti-inflammatories when I was about 17, and have heart tests and then really difficult pregnancies, chronic. I think for some people, it's like they get hit hard and they go down fast. And for some of us, it's just like a slow downhill slide. And that's more my story. It started with just chronically getting sick, lots of urinary tract infections, lots of sinus infections, and just basic weak immune system. But again, that's one of the problems with having like a driven personality. And for those of you out there who are athletes, you can push through incredible pain. And so sometimes it takes longer to get diagnosed because you have a high pain tolerance or you can push through a lot. So it did take me a while to figure it out. And also you have to really find the right doctors that can interpret the right kinds of tests. I was lucky enough that after those heart problems that a friend in the neighborhood said, "Hey Danielle, have you ever checked into Lyme disease?" And I kind of like pushed away like, "No, I think you're projecting your issues on me. I don't have Lyme." But then when things got worse and worse, I had to look into that. So I was really blessed that we did find it. And we actually have a handful of people just in my neighborhood with chronic Lyme disease. I believe there's about 5 of us. And a couple that are suspected. So if you have an illness that the doctors can't figure out what it is, sometimes it looks a lot like fibromyalgia. I've been diagnosed with fibromyalgia. It can look like chronic fatigue, migraines, just a poor immune system. Lupus is another one. And I mentioned before MS, Alzheimer's, ALS. And it can also hit some people really, really hard psychologically. I know one young lady in our group who was in the psychiatric hospital, and the doctor somehow decided to test for Lyme disease, and it came back positive. So it can like cause extreme mood swings. We use a phrase called Lyme rage, kind of like what you'd see with dementia or Alzheimer's, where you just get you're irrational, because again, you have bacteria in your brain that are just taking over, and they tend to like camp out in the frontal lobe, so you can't focus, you can't read. After I came out of that coma, I couldn't read. And it's not that I didn't know how to read, it was more that the energy that it took to focus was so hard that I'd have to sleep for 3 hours after reading just one page. It took every ounce of energy to focus and think. When I came out of that coma, when you have a clear conscience, dying is not a bad thing. Of course, you're sad for those you would leave behind, but it's the pain getting to death, and we're all going to die. That's part of being mortal, but the suffering is what is the most frightening. How much am I going to have to suffer to get there? And I am still very hopeful. I think in a month or two I'll probably be back in remission. And we just recently did some genetic testing that told me that I have a lot of problems with methylation and detoxing and estrogen dominance, and I don't detox estrogen, which it could be linked to all the breast cancer in my family. And so there's definitely, it's like so complex because it's hitting every system in your body, every organ, but it's really slow. So we know Lyme disease is a cousin to syphilis. Syphilis, we know famous people that have died from it, like Beethoven. It's a slow, long death that ends in madness and insanity, and it's the same with Lyme. Syphilis is a spirochete, just like Lyme or Borrelia Burgdorf is, or Borrelia in general. It's a spiral. So it's like this little spring that just embeds itself into tissues, and then they also like come together in a clump so that they can't, and build this, it's like this sticky stuff around them called biofilm, so the antibiotics can't get into it. And then there's one other form, it's called the L form, or like a bleb form. So it's a fascinating bacteria from a microbiology perspective, but it certainly is devastating to the body. So Lyme disease has 3 stages. The first stage is acute. The second one is chronic Lyme disease, and the third one is an autoimmune form of Lyme disease. Most people get the acute form and get on treatment. If they get in treatment right away, are able to take care of the illness. Most of the time it's contracted through ticks, but there are a lot of other ways to contract it too. For example, we think my son either contracted it in utero or else through blood transfusions. So other things that bite it can be contracted other ways. So recently there's been some research done on why do some people get the acute form and get over it, and other people get it and they can't get over it. And they found like a genetic base and reasoning for that. And there's a lot of controversy over chronic Lyme disease. And so I kind of, if you don't mind, wanted to give you a little bit of the political background behind that. So there are 2 infectious disease societies. There's IDSA and ILADS. And IDSA is a society that says there's no such thing as chronic Lyme disease. There's something called post-Lyme disease syndrome, and that Lyme disease should be treated with 2 weeks of antibiotics, and that's it. And there's another theory, though, with ILADS, where they say there is a chronic form, that this is a persister drug, and even after antibiotics, it continues. So they suggest long-term antibiotics. So essentially you have 2 societies that disagree with each other in a lot of areas. And currently the CDC supports IDSA's guidelines, which is really interesting because the CDC, a lot of their board members have fingers in a lot of pies with vaccines and a lot of things. So there is a lot of concern with them having dual intentions. So going back to ILADS, I think it's really interesting that the National Clearinghouse Guidelines, which is another government agency that tells doctors how to treat certain illnesses, on their website, they had both ILADS and IDSA's guidelines posted on there. But as of, I believe it's 2014, the IDSA's guidelines expired and they were removed. So, and they also didn't go through the rigorous process of having those guidelines accepted. So ILADS went through that rigorous process. They have a lot of research. Right now we're starting up long-term, really intensive research that shows that Lyme disease is a persister drug, or persister bacteria. And on that website, it posts ILADS as the guidelines to treat. But unfortunately, in the mainstream medical system, doctors don't have this updated information. And so that's also why it's really important for me to be able to talk about this, because a lot of people who suffer from chronic Lyme disease are afraid in the ER to say, I have chronic Lyme disease. And so in the medical system, we are treated like lepers. When you have so many medical symptoms, doctors automatically assume that it must be not finding the word, that it's in your head. So you have these really, really sick people, and doctors are putting them on antidepressants and things like that. Because if you have this many symptoms and it's ongoing, then it must be in your head, which is, it's really hard to be suffering like that physically and being told it's all in your head. because doctors are just not educated. So we have these people battling for their lives because this is a bacteria that attacks every organ in the body. It hides out in every tissue and in joints and in the brain. It can be life-threatening if it's not treated. There is no cure right now, and that's really hard for me to say, but it's true. There's no cure. So most of us are just treating the best we can, exploring all options to sustain ourselves until there is a cure that comes out. As we go forward, I mean, there are doctors stepping up, and they really are heroes in our community, and we are so grateful for those doctors. There's a doctor that I recently was reading his information because I'm always researching and learning and trying to be the best advocate I can for myself. And this doctor was saying he would prefer treating a stage 4 cancer patient before a chronic Lyme stage 3 Lyme patient any day, because this is such a tricky bacteria, and it damages your immune system. So, for example, I never get colds. Like everybody around me, I can maybe I'll cough a few times, but my body is just already so overwhelmed with bacteria that it can't take care of a cold. And there's something so tricky about Lyme too, because it's not just this crazy, really tricky bacteria, but it also comes with co-infections. So that can look like Babesia, Bartonella, Ehrlichia. There's a list of co-infections that it comes with, because it's like this dirty needle. These ticks bite into you, and you don't just get the Lyme, that you get everything inside of them. So like Babesia looks a lot like malaria, and we know malaria is pretty tricky to get rid of. And then you get parasites. And then when your immune system's compromised, you picked up everything, you pick up Epstein-Barr, cytomegalovirus, and things like that. Whereas other people who with healthy immune systems can fight those things off, people with Lyme's immune systems are just so overwhelmed and even attacking itself that it can't take care of those illnesses. So going back to the bacteria, Burgdorferi, it has 3 life stages, and the problem with antibiotics is you can hit it in one form and it will change itself into another form. So that's why a lot of doctors try to hit it with multiple antibiotics. Other doctors have a different approach. There's kind of 2 main approaches. You bombard the bacteria and wipe it out, or the other theory is that you build up the immune system so it can fight it off itself. And for the first 5 years of my illness, I tried to do the immune system part, but it just didn't work for me. So now we're doing more the aggressive attacking the bacteria itself. I kind of think you have to do both. There's a lot of theories about how to treat it. And the hardest thing is that not everyone reacts the same to this. So you have people that can be on the exact same treatment, be sick the exact same amount of time, and some people respond to it and some don't. So we have to that's the tricky part, is you just have to try so many treatments to find out what is going to work for you. So the origin goes way back to Lyme, Connecticut. Children started developing arthritis in alarming rates. And so that's when they discovered Borrelia burgdorferi. And there's actually 300 strains throughout the world. And that's explains more why the testing is so inaccurate, along with your body no longer makes antibodies because your immune system gets so damaged. But interesting enough, even in the United States, we have over 100 different strains. And the CDC reports there's 300,000 cases a year. So we're talking about an illness that we have it's twice as many cases of all forms of breast cancer. Almost everyone knows someone with breast cancer, which it's even dear to my heart, with my sister, my mother, my aunts, my grandmother. But this is definitely an epidemic, and that's another thing I just want the world to know, is that if you don't know someone with chronic Lyme, you will sooner or later. And as we become more aware of it and the word gets out, with all these great awareness campaigns, it will affect your life sooner or later. You know, there are a lot of conspiracies around if this is a biowarfare weapon. I personally don't like to get into that because it's not going to help me get better. We got to look to the future instead of the past. And there are great documentaries out there that cover the different issues and political concerns. Probably the #1 video to watch if you have a family member suffering or if you want to learn more about it. It's called Under Our Skin. It's a great documentary. And they also have a second follow-up documentary called Emergence, Under Our Skin Emergence. So those are both great documentaries to understand more about the history and where it's headed. It's interesting that the CDC just a couple years ago said we were having 30,000 new cases a year. And then when they started coming out with vaccine information, that's when they said, okay, this is 300,000. And that's probably a very, very, very low estimate. Some doctors anticipate it's at least 500,000 new cases every year, because not all of them are recorded with the CDC. It's hard because as soon as we hear the word conspiracy, we think of people who put on metal hats and look for UFOs and things like that. So that's why I hate to research it too much. But there's an island off of Lyme, Connecticut that was doing military research. And so that they believe that the bacteria, that's where it originally came from. And mycoplasma, which is a co-infection to Lyme disease. There's another documentary that I can't remember the name of. And that's another thing with Lyme. Our brains are so foggy. Sometimes I feel like I am just dumb as a rock, and it's because our brain is flooded with bacteria and toxins. I haven't researched a lot into it, but a doctor had to be really careful because of the backlash. But it was believed that mycoplasma was released into a prison, and all of a sudden all these people, and it kind of goes along with the Gulf War syndrome, is it? Which is another like bacterial viral infection. Again, like I wish I understood more about those, but it just hasn't been my focus, since my focus is more about getting better and healing. I think, I grew up with very conventional medication, and I was a pharmacy technician. So essentially I worked for a big pharma, and I have just this imagery of my mind. I remember standing behind the desk and telling someone, we suggest you don't use herbs because they're not FDA regulated. And now I just have to apologize to the universe because with a chronic illness, sometimes conventional medicine just doesn't work. So you have to look at the alternatives, or it's just pure stubbornness to not look at all the options. And I think we have to use all the tools we have. We need to, Heavenly Father has given us really good antibiotics, and He's given us great herbs. So I think, in my opinion, you use all the tools you can to finding healing. One big thing is nutritional IVs. It's really, really high doses of vitamin C, and I also put other things like magnesium or glutathione to help with detoxing into those IVs. And some people have recovered from chronic Lyme or gone into remission from those. Personally, it doesn't do that for me. I find it as a great supporting therapy. It can really help kind of boost my immune system, but I personally don't see it as a cure, and that's just my strong opinion, but those can definitely be helpful. But there are like other herbs, and right now I see a naturopathic doctor that's integrative. So again, she uses both antibiotics and like herbals to treat, because our organs are damaged. So this has hit me really hard with my thyroid and with my hormones. So my cysts are just covered, or my ovaries are just covered in cysts because my hormones have had a really hard time regulating. And then most people that have had it for really long also have severe adrenal fatigue. So your adrenals are not functioning how they should because you don't have energy because you're so fatigued, and like I have mitochondrial dysfunction, so my body doesn't do a good job of making energy, which means a lot of us live off of adrenaline. Whenever we have energy, it's from like an adrenaline form of energy. And when you keep living off that adrenaline, it just wears out your adrenals, which can be serious. A lot of people with Lyme have digestive problems. So when I told you when I went out to Kansas for that treatment, my stomach had just shut down all my digestion. I had really bad dysbiosis, and I wasn't absorbing anything. I dropped a lot of weight just because nothing was absorbed well. So a lot of us, recently we lost someone in the Lyme community from paralysis. I can't remember the exact name, gastroparalysis, just where it seizes up and it no longer works. Unfortunately, also a lot of deaths are from suicide because, again, there is no cure and is not well recognized, so it doesn't get the support that illnesses like cancer do. So it's kind of, again, going back to like we really are treated like lepers, and but it will be a part of everyone's lives because it is such an epidemic, and it is in all 50 states according to ILADS. IDSA, they disagree with that, but from my personal experience of being involved with the Utah Lyme Disease Alliance, we get so many people contacting us. I mean, at least a couple of weeks saying, I'm in Utah and I got bit and I'm sick and I need to find a doctor and I need to get help. So obviously, just from people's stories, we know Lyme is in Utah and in all 50 states. I know some people move to Hawaii just to try to avoid reinfection, because some people will even get their Lyme to a good place and then they'll get reinfected because they live in areas like the Northeast that it's so prevalent. Other symptoms, so the seizures, some people have grand mals. I've been really lucky that mine are partial, only affects a part of my brain. So I stay conscious during my seizures, so I can still drive. So I'm really lucky like that. But it's frustrating because a lot of medical tests don't pick up on things. So as an example, I went into the neurologist and said, I'm having the symptoms. And he said, okay, let's do some tests on you. And he ran an EEG. And as soon as they started up the strobe lights, it sent me into full body convulsions. And the technician looked at me and said, are you still with me? Because she wasn't sure if I'd lost consciousness, because obviously I was going into like this seizure situation. So although like it was sad to have to go through that, I was excited to be like, okay, we're going to get some answers, maybe we can find something that's going to help with this. And I went into the neurologist and he looked at the EEGs and said, yep, you're fine, you're good to go. And I was just devastated, like, oh my goodness, what is this in my head? Is this psychological? So after doing a little research, I learned that partial seizures don't show up on EEGs. So I went back into them and described in very deep detail what it feels like. So sometimes you get hit emotionally, like they happen differently. Not all of them are the same. Sometimes you start feeling twitchy. Other times you just feel like this doomed feeling, like it's very emotional. You feel like crying. And then there's like waves that go through my brain. I can feel these waves go through, and then it'll go into the jerking. And sometimes it's just my right side, sometimes it's just the left, and sometimes it's full body. So anyways, I went back into that neurologist and explained that, and he said, yeah, that sounds like a partial seizure. Let's put you on some seizure drugs, which have helped. They've helped, which is so sad, though, that like I had to do my own research. So through this process, I've learned that I have to be dependent upon myself and upon the Lord through like inspiration and prayer to know where we should go next with treatment and what we should do. And then also these amazing, brave doctors, they're willing to stick their heads out, because historically there have been doctors that have been threatened with to take away their medical license if they do long-term antibiotics. And my goodness, I wish I could show you guys all of these posts of people that are so sick in wheelchairs. Some of us are paralyzed. I don't know if I'll ever have feeling all the way back in my fingers. I have neuropathy in my hands. And like as a Lyme patient, simple things like going to the grocery store is a big deal. There have been a lot of times I go into the grocery store and all of a sudden I go blind in my left eye and then lose vision in my right. And so I have to call someone and say, I can't see, I need you to come get me. So it's made me like this type A driven person. Also I'm dependent upon other people. And it's a lot of humility when you can't do basic things like going to the grocery store. There's things like, what if I go to the grocery store and I get all the groceries and I make it that far and then I just get so weak that I can't carry the groceries out myself. So again, you have to learn to look for angels and people that are willing to show up and help you, or if it's simply the guy collecting the carts and offers to help you load your groceries. So there are so many kind people out there. And sometimes there's more compassion from total strangers than the people that are closest to you. And we see that a lot in our Lyme community. And that can be a really painful thing when someone's trying to fight this hidden illness, this invisible illness, and those close to them don't provide support that they need. Like during a seizure, it's like you're here, but you're not. It's kind of a strange sensation. It's like you're being electrocuted, but then at the same time, your brain is like in and out. There was one time that I had like 2 to 3 hours of seizures, and this is like classic Lyme person. Like my heart feels like it's going to explode, or I just had 2 hours of seizures, but I'm not sick enough to go to the ER. Like that's a classic Lyme thing. Like normal people who had chest pains or migraines every day or things like that would go into the ER, but these people are so sick that's kind of like, I'm not, I don't feel like I'm dying, so I'm not going to go to the ER. And so to go to the ER, you have to be really desperate. You have a seizure threshold. If I don't get enough sleep, that's going to lower my seizure threshold. If I get a cold on top of things, that's going to lower my seizure threshold. If I'm under a lot of stress, that will lower my seizure threshold. So I have to do a lot of self-care and a lot of detoxing, because these bacteria, when they die off, they release toxins and poisons into your body. So it's an autoimmune disease, it's a bacterial disease, and it's a toxic disease. Fluorescent lights also are really hard on me. Church and Costco are like the worst places. Like I have to get in and out as fast as I can. Like I was at a point before where I had to wear these huge ugly glasses. Like imagine the ugliest glasses you've ever seen, and that's what they were, because they wrapped all the way around, trying to block out as much light as possible, and those would help. But that's back like when it was at its worst. But I couldn't even go into public spaces without getting triggered or going blind. I think it just irritates, like most people don't see that fluorescent lights, they flash really fast. But it's like people who watch video games and have epilepsy, it can trigger the seizures. I don't know like the biomechanics behind it, but I know it just like irritates the brain. So seizures are like an electrical problem in the brain where everything just starts firing all at once and you get the uncontrolled motions. And sometimes it just feels like, is this really my body? Like I remember one day in Kansas, I I was laying down, and it was a really bad day. It was a really bad day. In fact, I ended up leaving in a wheelchair that day. But I remember just looking at the doctor and saying, "Get me out of this body," because it sometimes feels like such a torture chamber. Just, you never know what you're going to wake up to that morning. So we call it neuro Lyme. So some people have like a heart or cardiac Lyme where it attacks the heart. It just depends where the Lyme attacks. Generally, it attacks wherever it's weakest. If you have a weak blood-brain barrier, then that's when the bacteria get into the brain. But if you have a healthy, strong blood-brain barrier, then the bacteria don't get in. And if it kind of is also could be linked to gut health, and if you have a leaky gut, and if things are getting into your blood that shouldn't be. So generally, if you're having seizure, that means the bacteria is in your brain. And these suckers, they reproduce, they double every 24 hours. So they just spread out and go crazy. And so they're like releasing all these toxins. So I kind of imagine like these bacteria just like pooping and peeing all over in your body and in your head. So that's like the brain fog and then worst case seizures. And that can be grand mals or like mine, which are more like partial seizures. But that's a sign that it is late stage Lyme. Not everyone experiences that, but it means you're pretty progressed if you have that. If you talk to someone about Lyme, you know about detoxing, and there's a lot of different ways to do that. A lot of us, what I've found helps a lot is simple things like lemon juice and water. Ionic foot baths, I really like those. A lot of us use infrared saunas because our skin is our biggest organ, so you can sweat out the toxins. And usually when we go on treatment, we get sicker to get better. That's another thing you should learn about Lyme. When it's kind of like cancer, when you have to get sicker to get better. So that's called a Herxheimer reaction, and that's when the bacteria are dying off, they release those toxins. So other detoxing things that I like, and this is crazy, I never thought I would delve into this, but my digestion had shut down so much and I was just storing toxins that I started doing coffee enemas. So, which is like a lot of cancer patients that do a Gershwin approach, do like a juicing diet along with the coffee enemas. Because like for me, example, I have genetic issues. I don't make glutathione, and glutathione is really important to pulling out toxins. So the coffee enema helps detox the liver and helps with the glutathione. Epsom salt baths too really help, especially with the pain, because we're chronically in pain. So those I found have really been helpful. And then also there's supplements that you can take, like cilantro, berber is really good. And again, like it's so diverse, everyone's experience and what helps them and what doesn't. But those are kind of the basics of detoxing, and that treatment makes you sicker. So some people that are so fragile, I think the group that scare me the most and I worry about my friends is that they can't handle a Herxheimer reaction. They're already so fragile and so sick that adding antibiotics or something onto that, they can't handle that because they're already so frail. So that's when it gets really scary. Our bodies are our oldest friends. We've been with our bodies longer than anyone. So we know our bodies better than anyone else. So when you see cycles in your illness, you learn to identify those cycles. Like, is this a Herxheimer reaction, or is this a major, just I'm really toxic right now? So you have to really be intuitive with your own body and check in and to see where you're at with the toxicity. Generally, doctors, again, there's a lot of conflicting information. Currently, the doctor I see can tell me where my bacteria load is based on a test called a CB57, and that tests the natural killer cells. So if you have a very, very low level of killer bacteria cells, this is like a brain fog moment. killer cells, natural killer cells, then that's a good sign that you have Lyme disease, along with the, of course, clinical symptoms. So generally, if you have a CD57 of like 100 or 10%, then that tells me I'm in remission. The average person has like over 250 natural killer cells, but for me, 100 is doing really good. So that's kind of one way you can tell where you are and if you're closer to being in remission. The support, I think, is really the biggest thing because it's so isolating. You can't work, you can't go to school. People with chronic Lyme have the same quality of life as someone who has congenital heart failure. So they're really weak. But sometimes they look great because, too, if they're in a cyclic phase, sometimes we do fine and we're out in public and we look good. So people think, oh, well, they're doing okay because they look good today. The part you don't see is that I showed up to a party, but I was in bed for the next 3 days because it took a lot out of me. So just recognize that even though we look good and it looks like we're functioning well, it doesn't necessarily mean that we always feel like that. For me personally, what's helped me the most is I know it's hard to listen to people talking about being sick. And that's why I love that you're doing those videos. Like, people get bored of listening to you talk about you're sick, but we really need to be heard and listened to without judgment. And it's really empowering too to have someone just say, I believe you, and what you're going through is really hard. And I am behind you 100%. And even better, it's so great when people research and look into it and learn about that. That says so much to me when someone's willing to learn about my illness and how it might affect me. Yeah, I would just say the hardest thing is it's not recognized mainstream and the general medical community. And I would say the other thing is that it's chronic. I think, okay, I'm moving on with my life. I have goals. I'm going to do this. Like, I'm such a type A driven personality that I'm like, okay, we're moving on with my life. But the word chronic is the hard part. Like something acute, it's hard to be sick, but when it's just years and years and years, that's when it gets hard because it feels like, before is like, okay, I want to move on with my life. But now I realize this is a big part of my life. And even though I'm chronically ill, it doesn't mean that I can't still serve other people and help other people. I'm really involved with the Lyme community. I'm on the board with the Utah Lyme Disease Alliance, and we have monthly support groups, and it's an amazing, amazing group. So even if you don't have people that understand it, you can go to these meetings and you're around people that get it. And I'll tell you what, like chronic Lyme disease sufferers, they are an amazing group of people because to get to that point, they've really had to do their own research and studying, and it's a refiner's fire. It really is. It can make you bitter, or it can refine you and make you into a more compassionate, kinder person. So our trials are our gifts, right? Like when we suffer, we become more like the Savior. And we don't suffer anywhere close to what He has suffered, but we come close to understanding what He went through. Any words of encouragement? I just want to say we are warriors, and warriors have to stick together and have each other's back. And there is hope, and there's hope for a cure someday. And as our medicine becomes better, we have a great medical system, but as it becomes more knowledgeable and more research comes about this illness, I think we're going to have better medicines for Lyme disease. But for now, we just keep fighting and taking it a day at a time. And of course, just putting our faith in the atonement that even if we're not cured in this life, that someday we'll be resurrected and be whole. I think you have to find who your support system is and find if there's unhealthy or toxic relationships in your life and you're fighting chronic illness, it's healthier for you And it's hard and difficult, but you need to let toxic people out of your life so you can focus on your own healing.